And now to some breaking news. NBC has exclusively obtained a critical part of the White House's plan to roll out vaccines for children ages 5 to 11 years old.
Yep, the federal government is partnering with the Children's Hospital Association to prepare at least 100 clinics with vaccines just days before the CDC authorizes the shots. The FDA is expected to meet on October 26th, that's next Tuesday, to vote on the COVID vaccine for kids 11 and under. The CDC will then discuss the final approval on November 2nd and 3rd. If approved by both agencies, the COVID vaccine will be available for kids ahead of the holidays. NBC News correspondent Heidi Presbella joins us now from outside Children's National Hospital in Washington, D.C. with more on this exclusive report. Heidi, good morning. Tell us about this partnership between the White House and the Children's National Hospital to get kids vaccinated and this head start.
Yeah, good morning, Vicki. This announcement coming within a few hours. NBC News has learned exclusively that a major portion of the White House's plan to get as many children vaccinated as possible before the holidays is to partner with children's hospitals like this one. I'm outside here in Washington, D.C., but it won't be limited to this one. It will be at least 100 to 200 children's hospital associations. And doctors say that this is a critical difference with how we approach vaccinating children versus how we approach vaccinating adults. Take a listen to some of the doctors here who are on the front lines.
There's a group of people that want to have that one-on-one conversation with the trusted medical provider, their family members, to just hear more about the experience, see more people getting it, and feel more comfortable with time. And there's a lot of evidence that even just having that conversation, even if you have to do it over and over, can really help people make a decision that's safe for their family.
So the White House believing that it's going to be difficult to get children vaccinated unless it's done by doctors, nurses, and trusted healthcare providers, which is a very different look, guys, than when we had those mass vaccination clinics run by FEMA.
Well, the holidays, of course, just around the corner, Heidi. The looming question really remains whether or not the U.S. is going to see another surge in cases. I read an estimated 28 million kids are part of that 5 to 11 age group. So talk about the importance of vaccinating kids, not just to keep the spread of COVID down through the winter, but potentially for good and making it endemic.
Well, look, September, Vicki, really put a rest to the lie that COVID does not affect children. We saw surging cases. We saw surging hospitalizations across the country, particularly in the Deep South. And the White House knows by looking at the data that we cannot put an end to this pandemic unless we have many children vaccinated. But at the same time, they're concerned about parents who even themselves may be vaccinated, who have hesitation or just questions. Take a listen to some of the doctors here who I interviewed.
To get back to normal, a sustainable control of this disease is not possible without covering children. The math just doesn't add up. That's the secondary reason. But it has a benefit not just to adults if children get vaccinated, but for children themselves. So return to normal impacts children themselves, their own education, but also their entertainment and normal life. So they are part of the society and they have a stake in normalization.
So here's the concern. The latest polling shows us good news that 2/3 of parents do plan to get their kids vaccinated. However, when you break that down, only 1/3 say that they want to do it immediately. Another third say they'll wait and see, and 24% say no way. We need numbers higher than that, particularly going into the holiday season, guys.
Yeah, we showed that graphic a little earlier. I was going to bring that up, Heidi, because look at that. The wait and see, 32%. Who knows how long they want to wait and see. Parents are hesitant to vaccinate their children. How are doctors working on the messaging ahead of this upcoming vaccine rollout? What's the White House doing to help with those efforts?
Well, this is really a big part of this plan, is that the messaging will be coordinated between federal officials, HHS, as well as these children's hospitals. And the reason why the children's hospitals are important is because they're not just places where some of the sickest children who would be most at risk for severe case of COVID would come, and you can reach those kids with like immunocompromised systems or diabetes, asthma, but they are also entrees to some of the rural communities that are going to be the ones that will be harder to reach. For instance, I spoke with some doctors in Arkansas about the messaging as well and why this is important. Take a listen to one doctor who herself is a mother and got a little emotional about this moment that we've all been waiting for.
I have to remind myself as a doctor and a mom that as much as I think about coronavirus every day, that's not necessarily the most important thing on everyone's mind. And so I see that day to day in clinic. People have other obligations. They've learned to live within this environment of coronavirus. And so they're making choices to decrease their risk and keep themselves safe. And if this one seems scarier to them, they might just need more time to adjust, to hear more.
So the timing is really important here. If we do see this authorization that comes out the first week of November, we are then running headlong into the holidays with just weeks before the Thanksgiving holiday travel rush. Ladies.
All right, Heidi Preswell, so much information about how this is all going down. Thanks so much this morning. Well, new reports about an expanded COVID vaccine mandate in New York City coming this morning. According to the Wall Street Journal, all city workers will now be required to be inoculated, eliminating COVID testing options for employees who have not been vaccinated. City workers, including all New York City police and firefighters, will need to receive at least one dose of the vaccine by October 29th. Employees who don't comply with the mandate will be placed on unpaid leave and could risk losing their jobs. Mayor Bill de Blasio is expected to make that announcement later today.
Meanwhile, Secretary of Homeland Security Alejandro Mayorkas is isolating at home this morning after testing positive for COVID-19. A department spokesperson says Mayorkas is fully vaccinated and is experiencing only mild congestion. While he's isolating, he will continue to work from home, and DHS says contact tracing is now underway to check for any other possible exposures. Let's bring in our friend, Dr. Bob Lahita, for all the latest COVID headlines, and we'll go over these last two stories we just discussed. Dr. Lahita is, of course, a professor at the Hackensack Meridian School of Medicine and the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. Dr. Bob, always great to have you. Good morning. So let's start with that overnight news that I just mentioned. Secretary Alejandro Mayorkas is isolating at home after testing positive for COVID. Now, we know he was at an outdoor event with the president unmasked. Are the people that attended that event at risk for COVID? What do you think is happening here with the contact tracing?
Well, I think that's pretty scary, and I'm very happy to hear there's contact tracing because Alejandro Mayorkas was without the mask, as was President Biden and a number of other people. Fortunately, if you look at the picture, they were somewhat spread apart, but they were wearing no masks. And of course, outdoors, if you're fully vaccinated, you really don't need to wear the mask, at least in my opinion. And so right now, the contact testing for everybody is very, very important. It is definitely a breakthrough infection, and his symptoms are very mild. And he did get his booster with President Biden.
Dr. Lahita, let's turn now to vaccinations among children and teens. A new CDC study shows the Pfizer vaccine reduced the risk for hospitalization for kids 12 to 18 by 93%. So what should parents be thinking about when they are considering the vaccine and they see numbers like this?
They should be very, very excited about this because, and I heard a previous correspondent of yours saying that the doctors would now be giving the vaccine to the children. I've been saying that since the beginning, that physicians offices should have the vaccine and be able to give it to their patients. I think everyone has a trusted pediatrician for their children, and to have the child get the shot from somebody who you have great faith in gives a certain layer, a patina of security, if you will. The studies, involved kids from southern states. There were the vaccine was 93% effective. There were 464 children studied from various hospitals in the southern states, and many of them, I guess, the vast majority had comorbidities like asthma, diabetes, etc. So it wasn't really. It was kind of a biased group of children, but nevertheless, 93% protected.
Yeah. And Dr. Bob, I do want to ask you about that other piece of news that we just mentioned earlier. We have this new report from the Wall Street Journal that says all New York City public workers will now be required to be vaccinated. This means it's eliminating that testing as an option instead of vaccination. What do you make of this mandate? Is it going to help limit the spread of COVID in the city, especially among, for example, police officers who we know have the lower rate of vaccination?
Yes, it's going to be very, very important. I know that the biggest cause of death in police officers lately has been COVID-19. And by October 29th, some 46,000 workers within the city of New York have to be vaccinated. 71% of them are already vaccinated, and 96% of school workers are vaccinated. So this is really, really important in causing or producing what we call herd immunity. Everybody is going to be protected once we are all vaccinated. And I think that's the most important message we can give.
All right, Dr. Bob Lahita, thank you so much for shedding light on the numbers and the news this morning. We're going to begin with those supply chain issues. We've been bringing you plenty of reporting on these issues, and they're leaving shelves bare. Basic goods are tough to get. Well, one of the reasons for these shortages is a lack of truck drivers. It's been a problem since before the pandemic, but the situation's grown dire recently as a generation of truck drivers hang up their keys and e-commerce drives demand to new heights. NBC News Now correspondent Zincle Esamoah visited a trucking school in Savannah, Georgia, where a new, more diverse generation of drivers are taking the wheel. Good morning, Zincle. Happy to have you with us today. So help us understand just how bad this shortage has become and what's really behind it.
Thanks, Savannah. Yeah, the supply of drivers really is stalling. At the end of 2019, estimates said that around 60,000 truckers were missing from the industry. Now, experts are saying that could near as high as 100,000. And it's for the reasons you're saying. E-commerce has been booming. We spoke with president of Roadmaster Trucking Schools, who told us exactly why.
A lot of 50-something-year-old drivers were retiring early because they didn't want to be on the road risking their life. So as a result, and then on top of that, stimulus checks hit. E-commerce started booming, so now you needed a lot more drivers than you ever did before, and we had less than we ever had before.
And the need is particularly high around the nation's ports. We're currently by the nation's third largest port at Howard Shepherd Container Depot. About 150 trucks are going to come and go here. We're here early in the morning, but you can already see the trucks moving. And there are around 400 containers. And so truckers go to the ports, they bring items to these containers, and then more trucks come and come from the containers to your front door. So clearly demand is very high at this point.
Yeah, everything that we get comes to us one way or another by truck and that final mile. Zincle, the demographics are changing. We referenced it a little bit earlier. Older white men typically made up that population, but what are you seeing as you're visiting the trucker schools now?
Yeah, I'm so glad you asked that. We're seeing a lot of diversity, not just in terms of racial ethnicity, but also gender. I spoke with one man, Bernard. He's 40 years old and a parent, and he said, I'm here to support my family, right? But we're also seeing this industry is unique in pay equity. Truckers are paid by the mile, so the gender disparity with pay is a lot different, and the hours and flexibility are much better. In this case of Roadmaster Trucking School, the course is just 4 weeks long, and after that, students can take a test and get their commercial driver's license, so the bridge for entry is also a lot lower.
So tell us more about what these students are telling you about why they're getting into this business. What's making them decide that they want to go into trucking?
Yeah, I think that was the best part of our conversations with students. We heard from one former pizza delivery driver, Palmer. He's in his 20s. He said, I'm tired of making $8 an hour, and he wanted to explore another industry. He joined a bit skeptical, but now he's actually recruiting his friends. And I spoke with one woman, Sydney, who told us about her family and why this has been so important for her. Let's take a listen.
Being that I am a mother of two, and that I want to make sure that my children, like I said, don't have to worry about anything, don't have to, deal with the struggle that I've seen my mom having to deal with growing up, wondering if the lights are going to be on or if we're going to have a roof over our head or food on the table.
It's clear these drivers are very hopeful about what trucking will do for them, and it's at a time when the industry needs them the most. Savannah.
Absolutely. A time when the industry needs them the most. We're all going to be looking to these types of deliveries as we head into the holiday season. So certainly an important report. And Zing Clay, you're a new addition to the NBC News team, specifically here at Now. This is your first appearance on Morning News Now. Welcome to the show. Welcome to the family. So happy to have you on the show.
Welcome, Zing Clay. Former Trump aide Steve Bannon is one step closer to potentially facing charges for refusing to reply to a congressional subpoena. The January 6th Select Committee has voted to recommend contempt charges against him. The committee's vote was unanimous, 9-0, for defying the panel's request for information related to the January 6th insurrection at the Capitol.
Mr. Bannon stands alone in his complete defiance of our subpoena. That's not acceptable. No one in this country, no matter how wealthy or how powerful, is above the law.
NBC News Capitol Hill correspondent Ali Vitali joins us now from Washington. Hey, good morning, Ali. We have the committee's recommendation now. What comes next, and what happens if Bannon refuses to comply again?
Well, look, that's a pretty stunning moment last night. Somber mood in the chamber as they voted to hold him in contempt of Congress. What it does is it officially kicks off a process that you and I and Savannah have been talking about for many weeks now, since Steve Bannon was served that subpoena, and it was clear that he was not going to comply. What happens now is that the committee has made this referral. It will now go to the full floor of Congress for a vote. That's going to happen on Thursday. And if the full floor decides to vote this out, if it passes, it will then go to the Department of Justice, where they will decide whether or not to prosecute. The President Biden has said that he thinks that people like Bannon should face prosecution on this. At the same time, though, the DOJ is a separate entity. Congress people on this committee have said repeatedly that they have been trying to say that they think that this is what should be done, but letting the Justice Department make their own decisions on this. I will say, though, we all know this. Once it starts getting into the courts, this is when things start getting a little bit slower. For the committee's purposes, they would like this to happen as quickly as possible because they are on a clock here. We often talk about the midterms like they are so far off in the future, and they are, unless you're this congressional committee who's about to get into the legal weeds, and they are still on a clock here because as long as Democrats have the House, they can move forward on this in the way that they would like to, continuing to investigate. But if Republicans were to retake the House in 2022, this investigation would likely be neutered.
Yeah, the wheels of justice can move slowly. And in fact, the Justice Department hasn't indicted someone in circumstances like this since 1983. What are you hearing from lawmakers this morning, Ali?
Yeah. Well, look, again, they were somber about this last night because you have to think about what this entire committee is about. It's easy to forget as we get mired in the politics, but it's about January 6th, a deadly and tragic day in American history. That's something that one of the two Republicans on this committee, Liz Cheney, no stranger to drawing the ire of the president, she reminded her Republican colleagues of this yesterday in her remarks before the vote. Listen to how she said it.
Almost every one of my colleagues knows in your hearts that what happened on January 6th was profoundly wrong. You all know that there is no evidence of widespread election fraud sufficient to have changed the results of the election. You all know that the Dominion voting machines were not corrupted by a foreign power. You know these claims are false.
You know who's still pushing those claims, though? Former President Donald Trump, who still has such a stronghold on the entire Republican Party. I would note, though, Republican leader Mitch McConnell yesterday in a press conference with some of us reporters did say that he doesn't think it's helpful to continue looking to the past. Instead, he wants to look forward. His goal, of course, is to retake the Senate in the same way that Kevin McCarthy's goal is to retake the House. They're taking two very different ways of doing that, though, because for McConnell, he doesn't want to continue relitigating 2020. But if you go to a Trump rally, that is basically all the former president does. So it's going to become a problem for Republicans. It already is a problem for Republicans. Liz Cheney trying to remind them the foundation of democracy here was very much at stake on January 6th.
A lot of questions about accountability and consequences. Ali Vitali, thank you so much this morning.
Now, the desperate operation to free 17 kidnapped missionaries in Haiti continues. And this morning, we're learning more about the families at the center of this crisis. NBC News correspondent Sam Brock joins us now from Miami. He's been following this story. Sam, good morning. What's the latest here? What have we learned?
Yeah, Savannah, Vicky, good morning. Good to be with you. We now know that a Michigan couple and their 5 children were all abducted, guys, with the exception of a father who is now waiting to learn the fate of his family. The gang that took them is demanding a $17 million ransom, but FBI experts say that is money that should not be paid.
In this western Michigan neighborhood, they're praying for a family whose pastor says they visited Kenya and third world countries, but never Haiti until now.
We have a heart for people, and they were there because of that reason, because it's a very disadvantaged area, and our denomination is very quick to reach out and help.
A church member says the family of 7, 2 parents and 5 kids, all under 18 except for one, knew the risks, but went to the Caribbean country anyway to see how they could help. Now all of them kidnapped except for the father.
I would say they're very genuine. They are loving people. They had a heart for missions.
Now they're part of a group of 17 people kidnapped by a local gang demanding a $17 million ransom for their release, first reported by the Wall Street Journal.
We don't want to give these individuals money because this will further fuel their criminal enterprise.
Former FBI Special Agent in Charge Tim Gallagher says conditions in this case are working against the gang members.
The bad guys who took these kids, they require a lot of resources to keep them healthy.
Haiti has been upended by a lack of food, medicine, and any semblance of structure. Dr. Margaret Degas, who works at this hospital in Port-au-Prince, calls it a gangland.
Every level of the society, even the kids of people that sell things along the streets, okay, they are being kidnapped. So the situation has never been as bad as it is.
If you don't pay a ransom, what happens to the hostages?
Oh, very often the people are killed. It's a question of life or death.
And with respect to the ransom request, it is U.S. government policy not to pay in cases like this. But, guys, that does not prevent families or others from putting up the money if they have it. But obviously, that is a whole lot of money. Back to you.
Absolutely. Sam, thank you so much. Now it's time for a check on your morning news now weather, which means that Bill Cairns joins us. Hi, Bill. Good morning.
All right, who's ready to do a little bit of learning on a Wednesday? I know you guys want to pay close attention.
Does this come with a quiz, though?
And learn about no quiz.
Okay,
maybe tomorrow.
All right, then I'm ready.
So we're gonna learn about atmospheric rivers. Okay,
Great.
Atmospheric rivers. What is that? So yes, exactly. These are the events that give the West Coast huge rainfall events. And sometimes they go all the way from Hawaii to the West Coast. So this is above. This is where the jets fly. Usually all the humid air shown in yellow is where, that's where all the tropical air is. But occasionally some of it gets drawn up to the West Coast. And we call these atmospheric rivers. And as I mentioned, these are usually big rainfall events. So we have one ongoing now. You see that narrow ribbon of the green in there. So this is a moderate rain event that's happening now. But the one this weekend is going to be stronger. You can see the yellow and the green extending across the Pacific there. That one could bring us some significant flooding, and that'll come in as we head towards the maybe Saturday night and mostly on Sunday. And there is a climate connection to this. Atmospheric rivers are expected to become more common as we warm our planet. So here's the one today. It's not a huge ordeal, but you can see the rain that's in California, some snow at the highest of elevations. That is all great news. But when we add it together with the one we're expecting this weekend, we could get up to 10 inches in the mountains, especially. All those areas of yellow are at least 3 inches. We have 18 large fires still burning. 8 of them are in California. And so this will put a lot of those fires out. So that's fantastic news. But we do have to worry about those burn scars from the fires earlier this year. And because of that, we could get some debris flows and some mudslides this upcoming weekend. So the forecast for today, I didn't mention the east a lot. That's because it's gorgeous. Get outside and enjoy lunch today. 70s all the way up through New England.
Love to hear that. And it's Wednesday. Of course I know it's Wednesday. Look, we're both wearing pink. So next hour, I'm assuming we'll talk about the weekend. And I'll be prepared for your quiz, Bill.
Weekend forecast coming your way.
All right.
That's
Thanks, Bill.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.